And we are ready.
Okay. Good evening, everyone. Questions about the COVID-19 vaccine? Ask a Delaware school nurse. Welcome to everyone tuning in to this live broadcast, and welcome to our panelists, and I'll introduce them in a moment. Our purpose tonight is to share credible information about the COVID-19 vaccine, as well as opportunities to receive the COVID-19 vaccine with students, parents, and our communities. If you have questions for our Delaware school nurses, please email education.covidvaccine@doe.k12.de.us. Our school nurses are not the policymakers. We're not here to share our political or personal views. It's completely up to you with what you do with this information. But we're here to be informative. We've all faced great challenges throughout this past year in the COVID-19 pandemic. We want to reassure you that in Delaware, you have a school nurse whom you can reach out to for information and assistance if needed. We want to ensure that all students and their families have equitable access to receive the COVID-19 vaccine if you so choose to. We have opportunities to receive the COVID-19 vaccine, and there is a link on coronavirus.delaware.gov/vaccine where-can-i-get-my-vaccine / We'll share that again in a little bit, and I'll see if I can have that shared on the YouTube comments. We have opportunities in 4 locations for August 19th from 4 to 8 p.m. at Seaford Middle School, William Penn High School, Howard High School of Technology, and Lake Forest Central Elementary School. The second dose would be scheduled for the same location during the same time frame from 4 to 8 p.m. on September 9th. Now I want to introduce our panelists. I'll start by introducing Dana Carr, who is with us this evening as our support as our Delaware Division of Public Health liaison to Department of Education. I am Ann Covey. I'm the school health specialist for our school nurses in Delaware. And Dana, I'll let you share a little bit about yourself.
Well, thank you, Anne. And on behalf of the Division of Public Health, thanks so much to you, Anne, for pulling this together, and to your entire awesome team at the Delaware Department of Education. And thanks to these amazing, incredible school nurses that you have the honor of hearing from tonight. It's been such a pleasure to work with them, the COVID coordinators, your school chiefs, teachers, and all school faculty and staff over the past year. It has, as Anne said, been a year, and we just appreciate everyone working together and being able to be part of your team and work with y'all. We're so excited to be here tonight to support this group in answering these questions related to vaccines and vaccinations. We're also super excited to think about how we can apply our lessons learned from over the past year that allows us to welcome students back this fall safely and effectively. We've learned so much, including how to think about whether schools should be open and how they can be open safely. Everyone will probably remember that we talked a lot about looking at transmission rates and in the community as a prerequisite for opening or not opening schools. And we quickly sort of walked away from that way of thinking about whether schools should be open because we realized that school environments are actually very, very safe. We have almost no to very minimal transmission of COVID last year in the school environment because schools so effectively layered mitigation strategies. And so we're really excited to apply that again this year. And those mitigation strategies, we like to think of them like slices of Swiss cheese. And so none of them are perfect, but together they can make a really great sandwich. So those include masking, distancing wherever possible, creating great ventilation, cleaning frequently touched surfaces. You'll hear a little bit more about that. But as well as testing frequently, quarantine and isolation very, very quickly, and contact tracing. And now we can add vaccines to our Swiss cheese sandwich, so to speak. So we're very excited to move on to that topic. And with that, I'm going to pass it to Luann Hudson from the Cape Henlopen School District.
Thank you, Dana. Again, as Dana said, it's a pleasure to be with all of you tonight and with my counterparts on the panel. Thank you very much. I'm Luann Hudson. I am the Director of Instructional Support for the Cape Henlopen School District. But in the last year or so, otherwise known as the COVID coordinator for the Cape Henlopen School District, and I'll try to shed some light on some of the operational questions tonight. That has been a large part of my job in helping the schools and the school nurses, working hand in hand with the school nurse team always to make the very best decisions we can to keep everyone in our schools safe, our staff, our students, our visitors, everyone. So it's my pleasure to be here with all of you tonight, and I will turn it over to the next person I see on my screen, who is Delane Saxton.
Hey, good evening. My name is Delane Saxton. I am a school nurse with the John S. Charlton School, which is in the Cesar Rodney School District. I do specialize in children with special needs. So at my school, at the Charlton School, we have students aged 2 to 21, all with intellectual and developmental disabilities. We are the Kent County Center for the Delaware Autism Program as well. So we have children with intellectual disability, autism, and several with physical disabilities. And again, all from age 2 to 21. Also, I can share with you that I did work as a contact tracer for NORC out of the University of Chicago, which is the provider for the Delaware contact tracing program. So I do have information I can share on how contact tracing works in the community as well. I think my biggest goal tonight as a school nurse is just to make families feel safer about sending their children to school, to share with you what we've done in the Cesar Rodney School District and at the Charlton School to have our children come back safely, and all of them come back as the school year opens. Vaccination is an option for some, and it's not an option for others. Many are not eligible, and some may choose not to vaccinate. While we do recognize vaccination as the #1 strategy, we also would very much like to, or I would very much like to share with you what I see as the second most important strategy, and the thing that you can be one of the greatest helpers with, and that is masking. The thing that you do need to understand about COVID-19 is that it is a respiratory illness. And as a respiratory illness, the front doorway for entry into your body is your nose. So you need to cover the mask, use the mask. I did bring a mask, and I'm going to do it and see our colors from my school. Basic mask, doesn't have to be fancy. Over the nose, pinch it down, mold it to your face, ta-da. If your doorway is open, it will happily march right up your nose, and your body will not like it as a tenant in your new little house, your respiratory house. So once it's in, it's hard to get rid of. It's hard to eradicate. It can do damage that is lifelong and lasting. It can do acute and chronic damage. So again, close your doors. Teach your child to wear their mask correctly. That is the #1 thing that you can do. That way, if they do fail to socially distance, if they do turn around and look at their classmate, if they do forget this or that, through all the other layered mitigation strategies that we have in place, the mask is the thing that will keep your child the safest at school. And with that, I'll pass it on to Heidi.
Hi, good evening, everyone. Thanks, Delane, because I think you just took the words out of all the rest of the school nurses' mouths about masking being so important and proper masking. So thank you for going over that. And we'll be reiterating that throughout the night. My name is Heidi Hildick. I am the lead nurse for the Colonial School District in Newcastle County. And I have been a nurse for 24 years. Most of those years I have spent taking care of children with special needs. In the past 10 years, I have been a nurse at the John G. Leach School with students with special healthcare needs. And I will pass it on to Eileen.
Thank you, Heidi. My name is Eileen McLaurin, school nurse at Thomas Edison Charter. I've been a school nurse for 11 years at Thomas Edison, and also we have grades kindergarten through 8th grade. My background as a nurse was also at St. Francis Hospital. Some of the specialties were cardiology, bariatric, and med surgical units. I'm delighted to be here tonight. Hopefully I can share some of the information that I've learned along the way through my online courses with the National Association of School Nursing and through meetings with our lead nurses and our COVID liaisons. I'm not sure who's next. I think Suzanne.
Hi, thank you for having me here tonight. I'm pleased to be here to represent the private, independent, and Catholic or parochial schools for this webinar. I've been a nurse for 25 years. I've been a school nurse for 11, and the past year has been challenging. I'm the lead nurse for the private and independent schools, and I work very closely with Chris Zimmerman, who is the lead nurse for Catholic schools. One of the things, we're in a little bit of a different situation. We don't have, this year we were mandated by the regulations of the state of emergency by the governor. This year, the only thing that is mandated is the masks, and the mask mandate does pertain to private, independent, and Catholic schools. So we all need to follow that guideline and that mitigation strategy, which is so important. Some of the other things, we're not guided by a district like some of the other like the other school districts are here. So each school, each private and independent school and Catholic school is making decisions on their own for their mitigation strategies. So the nurses have really worked together so that we can pool our ideas and take the best information we can from DPH and CDC and make sure all of our schools are safe. So thanks. I'm glad to be here to represent. And next, let's see who else is on here. Ann Bollinger.
Hi there, my name is Ann Bollinger. I am from Woodbridge School District in Bridgeville, Delaware. I am the middle school nurse. We have 6th through 8th grade in my building. Glad to be here, and a little background, I do also work at the emergency room at one of the local hospitals. So it's been very helpful with this COVID situation to be able to use what I'm learning over at the hospital, back to school, and school at the hospital. So I'm turning it back over to Ann Covey.
All right. We'll go ahead and take our slide down so that we can see all of our panelists. Thank you. We have Kevin behind the scenes helping us out here. All right, we'll start right into their pre-submitted questions that people emailed in to us. The first question we have is it safe to send my child to school even if they have a medical condition?
I can start, Ann, and then others can chime in behind me. I first want to kind of reiterate what Dana Carr had said, that we have mitigation strategies in place, and it's that Swiss cheese model. So your student, if we're specifically talking about students with special healthcare needs or medical concerns, the masking mandate that we have now is huge. So all students, staff, anyone entering any of our school buildings will be masked. We teach, as school nurses, we teach our staff. We have posters up for visitors on proper mask wearing. We have posters up for hand washing. That's another huge mitigation strategy. We have hand sanitizer available inside and outside of most classrooms when students are entering and exiting, staff, visitors, etc. I should say most of the districts have partnered with Quidel. It's a public health partnership with DOE and Quidel Corporation to offer testing for COVID, routine testing, not for symptomatic students and staff, but just as, I'm sorry, I'm blanking on the word. Someone can help me. Routine testing, right?
Screening.
Screening, thank you. Screening. So make sure you check your district's website to see how you can enroll in their testing, because we do need to have permission from parents to have Quidel test students. And it will be on a weekly basis. So that's an important mitigation strategy that we have in place as well. But speaking specifically of students with special healthcare needs, another important thing to do is to always speak with your medical team. They are going to be able to guide you in what's best for your student. So speak with your doctors, and then once you've spoken with them, go to your school nurse, discuss action plans, discuss what should be in individualized healthcare plans. What does your student need while they're in school? And we will work with you to make it the safest environment possible.
Heidi, I just wanted to add one thing regarding testing. I know that Quidel has a state contract with the state for our schools, but the curative sites are still available also for PCR testing, and they still are pretty convenient. There's still a lot of sites. I was looking on there earlier today, and that's always an option if your child would have symptoms, or if you suspected exposure, or you're unvaccinated and just want to get them tested weekly. That's an option for you.
I can chime in a bit too. I'm in special needs, but it also applies to other things that we're doing in the Cesar Rodney School District, not just to our school. But again, there's the screener that we ask all staff to do before they come. Please don't come into the school nurse. We ask them not to come to the school nurse and ask, well, what can I do because I have this? You need to screen yourself before and make contact before entering the school. We also ask that all of our parents go through that. It's not necessarily a written one, but like a mental checklist. Does my child have any of these symptoms? If your child has any symptoms, and any and everything can almost be a symptom of COVID in a child. So if your child is in the least bit sick, you're concerned they might be sick, there's indications they're sick, please do not send them to school. Keep them home. That's one of the best things that we can ask you to do to play on our team and keep everyone healthy. We also limit cohorts in our schools, so we try to keep not as much interchange. And I know that's not possible in all schools, but we are able to do that at Charlton. We've had our ventilation systems checked. We have an isolation room. We do not mix sick students with healthy students. So if a student's coming down for routine healthcare with the nurse, they're not seen in the same room as a child that potentially has a contagious illness. So we do have an isolation room. We also have an aerosolization room where we do any aerosolized procedures. They have asked that students that need breathing treatments, they try first with a handheld inhaler, and then they can also go to a nebulizer if absolutely necessary, but then we have to do that in a separate area for aerosolization. We also have sign-in and sign-out sheets on our rooms because we have a lot of specialty groups that go in the rooms, our OT, PT, speech. So they sign in, they sign their time in, they sign their time out, and then for contact tracing, it's much easier. We go take the note off the door and we check it. And if anybody reaches the contact tracing criteria, then we look into that farther. Ventilation systems, I know Cesar Rodney had their HVAC specialists come in and check out our ventilation and make some changes to make it safer for our students. Sick policies, stay home when ill. We don't promote perfect attendance during COVID. If you need to stay home, you stay home, and that's both with staff and student. And hygiene, of course, like Holly said, you know, there's always hygiene instruction. There's gels, there's soap, there's water, and we do impress upon everyone to do the proper hand hygiene and do it frequently.
I just wanted to also add for the parents that really have some uneasy feeling about sending a child with chronic conditions. It's okay to call the school, maybe make an appointment to come in and see the classroom, see how the desks are facing. Usually they're facing all in the same direction. I know at our school we have the barriers around each desk. So to make yourself feel more comfortable after having a conversation with your primary care provider, have a conversation with the administration at the school.
All right. Some great discussion and great points on your mitigation strategies that they're taking place in your schools. There's similar strategies across the state. We try to keep things as consistent as possible. It's just going to look different in each school, sort of different buildings, and operationally. I can give Luanna an opportunity to chime in on that. on how that looks to bring in students at full capacity. That was one of our questions that was submitted. How do we bring back all of our students 100% safely?
Well, I think all my friends have made really great comments about the way we can do that safely, and it is that layered mitigation approach. We are fully prepared to keep children as distanced as we possibly can. We're all, I know, aiming for at least 3 feet of distance from student to student in the classroom and even in the cafeteria. I noticed a question about what about when you're eating in the cafeteria? Well, and I know in our schools, we try to limit the time, even that the kids have the mask off. They don't just walk into the cafeteria and take off their masks. They walk in, they get their food, they are seated 3 feet, at least 3 feet apart from each other. They take their mask off only when eating, then put it back on. So we always aim for less than 15 minutes with the mask off, and that can save some quarantines should somebody in the group become positive. Along with that are things that you might not think of that we do all the time to make sure that we can limit the exposure of one another, like assigned seating always, even in the cafeterias, where we know they're eating basically in the same area with the same kids every day. So that, again, if one student becomes positive, that student has had as little footprint in the building as possible. We also aim to have them eating spread out in other areas, outside, as long as the weather holds. I think most of us are also using gymnasium spaces when available, or other large areas where students can spread out and enjoy their lunch. And of course, if they can go outside and distance, that's even nicer, because masks are not required outside, and it does give the kids a break and the adults a break and everybody else who needs a break. And we're very aware of that. I noticed a question about transportation. How are we going to manage transportation? And that is very similar to what I just mentioned about classrooms and cafeterias, is that we create as much space as possible between students. We seat students from the same household in the same bus seats. So again, those are, people you're exposed to all the time. You're not creating extra risk there. And the mask mandate has been enforced, or is enforceable on all public transportation anyway, even before the mask mandate, the recent mask mandate for K-12. So masking on buses is something our students have been used to since last September. In Cape Henlopen, we've had about 80% of our students present for in-person learning since last September. And as Dana and others have mentioned, very low classroom transmission from student to student because of the layered mitigation strategies we've put in place. And we will continue doing all of those things operationally to make things work. Our custodial staffs have been well trained, as have the transportation staff, for how to clean, how to properly sanitize if a student becomes positive or is suspected to be positive. That's when a sanitation, of a classroom would happen. The CDC did back down on some of the most rigid standards for wiping down surfaces every 15 minutes last spring, when I believe they have found that the virus just isn't as transmittable on surfaces. So, but regular and routine cleaning is still in place with all of the proper chemicals, and everybody has been trained in how to use those chemicals and solutions properly in classrooms and bathrooms and all of our other high touch areas, cafeterias and hallways, railings, all of those areas in our schools. Anything anybody wants to add to that?
I would just add that what you said, Luann, about, assigned seating and making sure we know basically where everyone is as at all times during the school day. And all the districts have embraced that. And even on the buses, there are going to be bus charts or there's going to be a camera so that, again, it can assist us in contact tracing. And I think one of the questions was, and Delane, you can speak on this more as well, would my student be quarantined if a student in a classroom tested positive, or even we could translate that to if a student on a bus tested positive. And that all has to do with contact tracing, where the student is relative to the positive case. And that's why it's so important to know where the students are. And that's why we have all made such an effort to know the assigned seats, and the bus drivers know, the aides know, the classroom teachers know. So we have a good system in place, I believe.
I just wanted to add too that I think one of the things that's so important about life in this pandemic is that it's a whole team effort. Like I'm at Salesianum School, and we rely on our teachers to model behavior. We rely on them to make sure people are wearing their mask properly, our custodial staff, facilities. And in addition to that, students and parents, like, we need your help. We need you to advocate for these mitigation strategies with your child, and to send them to school so that everyone can be safe, not just your child, but your neighbor's child, your friend's child, and everyone in the building. So it is a really big team effort, and the nurses appreciate everyone's participation in this.
I just want to go back and add as well that another of the questions I saw was, will I know? Will I know if there's a positive case in my child's classroom, on the school bus, in the cafeteria? The answer is yes and no. We keep track of all COVID cases, and they are announced, and there are either messages. Some districts put their messages on the website and have a listing there. Others, and it might be by school, might be by grade level. Rarely does it go down to the classroom level unless your child has been directly exposed. So if your child has been exposed to a positive case, you will know, because somebody will be calling you to talk to you about quarantining, or if your child is positive, the isolation. And I'm sure Delane could speak for hours on this topic, but you will have an idea of the positive cases coming through your child's school. You won't always know exactly where it is, although the parent network generally seems to share lots of information. But legally, from our standpoint, we will be notifying the public, and every district and school does that slightly differently.
So I can add to that a bit, just to reassure people that contact tracing is confidential from every aspect. It's confidential when it's being done by the school nurse. It's confidential when it's being done by NORC for the state of Delaware. So even if, when you provide a name to a contact tracer at NORC, that person takes your information down, but they will not have that available. So when they do the contact case, they cannot see who the positive case is. So that information isn't even shareable. It's not possible to share it that way. Within the school, the only reason we can ever share a name of who the positive case is just trying to determine who was in direct contact with that person. So we may have to ask a teacher who was in direct contact with this particular person, but it's confidential. Having COVID-19 is nothing to be ashamed of. It's a virus. It's like having a cold, only this cold has much more detrimental fallout when you do contract it. So again, it is confidential. It's done with the utmost confidentiality. People who will ask, try to hint, sorry, it's confidential. You wouldn't want me to share it about you. You don't want me to share it about anybody else, but it's not out of shame. It's out of confidentiality. Contact tracing. As far as contact tracing, once it happens and we've identified to public health, we have to fill out a report that goes into public health to where Dana works. That information goes in and says who within the school is our positive case and who has been in contact within the school. At that point, the school nurse is out. It goes to the contact tracing with the state of Delaware, with NORC, and they are going to make a phone call. So on the individual's phone call, the parent's phone is going to say DPH or Delaware Public Health. I'm sorry, it says DE Public Health on your phone, and you should answer that call. The purpose of contact tracing is not to be nosy or to pry. It is to provide you with information, outreach, resources, and follow up and to guide you through the process. The sad thing about COVID-19, it is one of the illnesses that really there's not a lot of help there for you. Either you're sick enough to go to the hospital or you're taking care of yourself or your loved ones at home. So what contact tracing can do for you is help link to you, call in. There's been episodes where contact tracers have had to call 911 because the person who answered the phone couldn't breathe well enough to do it for themselves. So just so you know, like, they're not there to be bothersome to you or to pry. They're not going to ask for financial information, social security numbers, anything like that. Their sole purpose is to provide you information, resources, outreach, and follow-up and guidance through COVID-19, which is a storm all its own. So it's not, again, it's not there to be bothersome. It also generates the letter that you may need to show your employer if you have to stay home with your child. It generates the letter that the school district will need for the absenteeism for the child. It'll guide you through anything about quarantine, the length of quarantine, how to test during quarantine, why testing doesn't get you out of quarantine, because once you're tested, so if you test negative on day one after you're exposed, it really means nothing because it takes time for the virus to replicate in the system of the person exposed before you can even test positive. So therefore, like, you can't just run out and get a test and say, well, I'm negative, so there's no quarantine. But there is a route to a little bit earlier release from quarantine, which will be made available to you. So again, answer the phone when the contact tracers call you. They're there to help you. You don't have to answer questions that you choose not to answer. They cannot force you to answer. But if you work your way through the interview with them, you'll find you'll have more resources than you had before you started.
I'd just like to add to that, the piece with the mask, adding another dimension, another layer to slowing down the transmission, and the spacing as well as the hand washing. So with someone being contracting COVID-19, if they're spaced, if your child is spaced away from the person that's positive and they're wearing their mask, they have 2 more layers of protection of avoiding the transmission. So that's why we keep going back to the spacing and the proper wearing of the mask as well as the hand hygiene.
All right. Delaney, you're muted.
Sorry, I pushed them away. I can't emphasize enough what you're saying. Mask wearing, that is your gold ticket. Outside of vaccination, which many of our students aren't eligible for, mask wearing, that's what keeps us as nurses safe, does it not? That's what we wear. That's how we stay safe when we're working with your child who may very well have COVID-19. We mask. There was also the question about face shields. So when you're thinking of a face shield does not replace a face mask. A face shield, think of it like a dust shield. If you're doing something with sawdust, dust is flying. A mask prevents you from inhaling it. If you're covering your nose and your mouth, it prevents the inhalation of it. A shield would not do that. So just virus particles are much smaller than sawdust particles. So they're going right up your nose if it's not covered. The shield is to prevent transmission by your eyes. It's basically an eye covering. So it is not a replacement for a mask. It's not in lieu of a mask, it's in conjunction. So if I'm working with a student where there's potential splash, I'll have both a mask and a shield on. So, and we do have enough, we have adequate PPE for all of our staff. Any PPE that they feel needed, what we've recommended, they're all trained in PPE, they're all trained in how to use it, how to dispose of it, how to put it on, how to take it off. We have that all video recorded so they can go back and watch it again if they choose to. We have open door policy for them to ask questions in the nurse's office. But again, know what your particular things are for, just like gloves. Wearing gloves does not eliminate the need to wash your hands. Gloves can carry the germs. COVID will ride on your gloves just as happily as it will ride on your skin. Touch your face, touch your nose, transfer it. So again, hand washing is more important than gloving with COVID-19. It's not a contact type transfer. Again, respiratory droplets, cover your nose. Can't say enough, cover your nose, cover your nose. I'm one of those people that looks to see whose nose covered before I get in their line at the checkout because I don't want them breathing on my stuff. So cover your nose, cover your nose, cover your nose.
And just to clarify, PPE for those not aware of it, it's the face shields that we have, the masks, the gloves, the gowns. that the nurses will use in event there's a splash, or even using nebulizer treatments per se.
Along those lines of the discussion about the face shield, and that we had a couple of questions about that, but what about the barriers, the plexiglass dividers? We've had a lot of discussion about that, and in comparison to the face shield, does anybody want to touch base on the dividers or plexiglass barriers?
I'm glad to kick it off, and I'll throw it to Delene because she had such a good way of explaining about the face shields, or anyone else. But it's the same idea, basically, that air is circulating all around us, and a plexiglass piece of plexiglass between two people isn't going to stop the air from sort of flowing around and about. So in terms of respiratory droplets, they're still all there in the air. And the plexiglass doesn't do anything to stop the respiratory droplets from floating in the air and going up somebody's nose. They may be helpful insofar as it's a reminder of how far away to stay from people. So in that respect, it may help remind young students in particular to stay further away from one another. But in terms of the spread of respiratory droplets, there really is no benefit. And CDC, when they sort of change their guidance over time, they really dropped that as a recommendation. That was in the springtime. And that was because there really was no evidence to suggest that it was an effective mitigation strategy, as they have felt with masking, distancing, and all the other pieces we've talked about.
Yeah, I totally agree. We've tried it, but that was what it was considered, one of the things to try, one of the Swiss cheese holes, but it's not effective. I mean, it might be effective for a direct hit if somebody were to sneeze and not cover. It might be better than nothing at all. But again, it's like the face shield. It's just a bigger face shield. The other thing I've seen it helpful for little kids who like to reach across the table and grab something that's not theirs. It does provide a divider for like grabbing and sharing. Because again, we're working with 2-year-olds with autism and stuff, and they might reach. It might be a preventative for that, but in general, we have not found them to be. In some ways, they're more cumbersome than they are helpful.
Great, thanks, guys. Great discussion. I have a parent who is asking, how can I pre-register my 16-year-old for the COVID vaccine? What documents would they need to get the vaccine, and which vaccine would they be getting?
Well, Pfizer is the only one for 16 and up right now that's currently approved for 16 and above. As far as registration, it would depend on where you're going. I mean, some places have pre-registration, some you can go right to the pharmacy, some at your doctor's office. So each one's individual. I think it would be based primarily on where you're choosing to have your child vaccinated, what the registration process would be, but many of them just take walk-ups as well. Again, you guys may be more familiar with other places in the state, but around here, you can pretty much get wherever they're offering Pfizer, you can get vaccinated, and the parent does have to sign. With the school vaccinations, I don't believe they have to be present, but they have to have signed the actual authorization form. But it's pretty readily available now, unlike in previous times.
We just had a clinic last week, and it's run by Albertsons, and I think that's who's doing the other school-based clinics that are coming up on Thursday. And a parent does not have to be present. The form does have to be signed, and that's fine as long as there is school staff available. It doesn't have to be that student's school, just school staff in general. As a rep, that's what Albertsons had relayed to me.
And just to clarify one point, the Pfizer vaccine is approved for students age 12 and up. So, so anyone who is that age, it's not just 16 and up. So 12 and ups are eligible to receive. And we are so excited, as Anne mentioned, we have got 4 clinics coming up. There's also another one at Dover High School on the 19th of August. That's a second dose clinic, but we will include the registration links for you as well. I think at the end, I'm not sure, Anne, correct me, but we can always, and they provide that to you, and they will also be taking walk-ups, and that those are open to everyone, family, faculty, staff, students that are eligible. And we're excited.
I wanted to clarify one thing also. If your child has had the first vaccine maybe a couple months ago, and for whatever reason, maybe they were you were away or whatever, and you did not get an opportunity to get the second dose, you can show up at one of the school-based clinics to get the second dose as well. Just bring your vaccine card with you so that they are aware that your child has already had one dose.
And I'm sorry.
It's okay. I also saw on Delaware.gov where you can, there's a link where you can go to find out where you can get vaccinated. When I checked it, I did see Westside Family Health was listed, and it was 5 days a week in different areas, Dover, Newark, Wilmington, and I forgot the fourth area, but Delaware.gov.
All right.
Make sure
and-
everyone's aware too that the COVID vaccines are free. There's no charge. There is no charge for them.
That
You
is
don't have to
also a
worry.
question.
They don't check
Are they free?
immigration status. They're not worried about your immigration status. They're not worried about your insurance. It is available to everyone for free.
And
If
can I
you-
just,
Mhm.
sorry, go ahead. So can I just say also, since we're all here, is when you do get your vaccination card signed and completed, is to take a picture on your phone. That way you've got it, because like myself, when I took one of my children to get their second vaccine, I forgot the card. So I was able to get it up there and bring it up so they could look at the date and confirm that we had done the first one. But it's been very helpful also during triage in the emergency room when they don't have the card with them, that they're able to pull up the picture of it and we can jot that down and enter it into their hospital record. Because that is one of the questions in triage that we ask.
It would be significant also if they were being considered as a close contact. So I think it'd be important to kind of touch on that. Why would it be so important for them to have a copy of their vaccination card?
So
Also, and when they do contact tracing, when they call from NORC, they need the actual dates, and those dates need to match. They need to be accurate when they give them to them. So they don't want to guess what their date was they were vaccinated. When they do call you, they're going to need the specific date of each vaccination.
All right. So does somebody want to touch on the other piece of that? If someone is fully vaccinated and identified as a close contact, would they still need to quarantine?
right. So if you have been fully vaccinated, and that means if it's a 2-dose, and if it's student, it would be Pfizer, 18 or older, it could be Pfizer, Moderna, or J&J. You're fully vaccinated and you're asymptomatic and you have an exposure, you do not need to quarantine. So that's important, and that's why you need to have your card and your copy. If things change and you do become symptomatic, it changes.
Thank you.
I did want to
All
say
right.
that the CDC is also recommending that if you are fully vaccinated and had an exposure, that it's advised to test between days 3 and 5 post-exposure, just for your safety and just to make sure that you're not an asymptomatic positive.
And see, you could have that done at Quidel. So if parents have signed for it, that could be done at Quidel at school. Or if it's a staff person, as long as you're asymptomatic, you could have those follow-up tests done right at your workplace or your school site.
All right. Thank you. I have a parent ask, is the vaccine required for my child to return to school in person?
I'll take that. No, the vaccine is not required. It's not a mandatory thing. What's mandatory now is the mask. Vaccines are still optional, and that's why we're here to give you as much information so that you can make a sound decision for you and your family. Also, I would suggest talking to your your physician. I know in the beginning, I was on the fence about getting the vaccine, and after doing some research and discussing it with my physician, I felt more comfortable about getting my vaccine. And one way I looked at it is, I don't think I could forgive myself if I transmitted COVID to someone and it was not a good outcome. So even if you choose not to, the mask, the spacing, and the hand washing is so important.
I just
right.
wanted to add on to the question regarding the required vaccination. I know for private, independent, and Catholic schools, we do kind of have a little bit of leeway there that we could require it. We are able to require it. And to my knowledge, right now, there's only one that's a residential school that will be requiring it because the students live on campus and stay overnight. And it's more like a college congregate setting. So they are requiring it. But as of right now, I don't believe any of the private schools are, but that is always an option.
And
I wanted
also
to add
maybe just to,
in-
oh,
Go ahead.
sorry. Go ahead.
I just
Delaney.
wanted to add into that while COVID vaccine is not required, there are other vaccines that are required. And you do need to make sure that your students are up to date on those vaccines, whether it's their 5-year shots or their meningitis shots, whatever the required vaccines are for their age group. They are still required to have those vaccines. And we know that some things have fallen behind during the COVID, whether it's visits for their physical exams or what have you. So those do need to be called up and need to be turned into the school, the records, so we can update the records. Also, if your child has had a COVID infection recently and is an athlete or is returning to play, there are protocols to make sure that your child is safe as far as cardiac conditions that affect students, then student athletes, people returning to physical activity after COVID. So you definitely want to have a conversation with your child's doctor about their return to activities if they've had an active COVID infection. And that's regardless of the severity of their COVID infection.
All right.
Can I
Thank
add-
you, Delane.
Can I
Sure.
add also, according to Delaware.gov, that if you choose to get the COVID-19 for your child, you can get other vaccines at the same time. It does read that the side effects are generally the same. So.
All right. Thank you, Eileen. So we have all of these questions are so important, and I know we've had some great discussion and reviewing all of these things, some responses for our parents and families that are attending tonight. We have about 10 minutes, so I just want to make sure that we get through a few more questions. And I just wanted to mention that if we do not address your question specifically in this hour, we were limited on time, of course, and we will respond if the question has been emailed into the education.covidvaccine@doe.k12.de.us, and that was the email that we shared at the beginning on the slide. So if you've submitted your question, we will respond even if we don't get time to read it on here. So we did want to make sure we've talked about registering and how they can find a site near them. That was very important. So for families that choose to have their child vaccinated, can have access to receiving the vaccine. They're available throughout the state. And there was a question about if pregnant women can receive the COVID-19 vaccine, if it's safe, and if they didn't get it when they were pregnant, but then decide they did want it, could they get the vaccine while they're breastfeeding?
I can go with it. The CDC did come out with guidelines. They've been studying the use of the vaccination in pregnant women and breastfeeding women since they started doing the enrollments. They did come out with the declaration that it is considered safe. Again, you would always want to check with your individual obstetrician and discuss it with them based on your own individualized case. But they have identified it as safe for people who are both pregnant or individuals that are breastfeeding. And additionally, they've also cautioned that the outcomes for pregnant women from contracting COVID are much, much more severe than any possible side effects from getting the vaccination. So again, have that discussion with your obstetrician, be you a staff, a parent, if there's any concerns, or even a student who's pregnant and dealing with trying to decide on a vaccination. But always bring your obstetrician into that. And then again, I would recommend people look up at the latest CDC information on their CDC website. Just type in CDC pregnant breastfeeding COVID-19 vaccine and it'll pop right up.
And I'll just add that on the division of, or the coronavirus.delaware.gov, I believe, website, if you go to about the science for the COVID-19 vaccine, there are questions and answers specifically about fertility. And there is no evidence that there is any impact on current or future fertility with the vaccine. So there's a whole bunch of information on the website. It's coronavirus.delaware.gov.
Awesome, thank you. All right, there's a question that a parent is asking, will school personnel get tested or vaccinated? Got a little bit of conversation on this, but is that going to be?
So at this point, just like students, school personnel are not mandated to be vaccinated for COVID-19, but they will have the opportunity for testing through Quidel or whomever your district or school is using for testing.
And just so parents know, school teachers, school staff, all school staff, not just teachers, but specialists, everyone was prioritized. They were actually one of the first subsets of individuals besides first responders that were offered the COVID vaccine. So it has been available for staff, but it is their personal choice if they choose to vaccinate or not. It is not mandated at this time, like Heidi said.
For the private, independent, and Catholic schools, I know that last year we had required testing of all of our faculty monthly. This year, we are trying to implement that in a different way using Quidel, but at this point we haven't put it into place. And right now the vaccine is not required for all faculty and staff, but for some of the private independent schools, that might be something they will be considering. So it's not off the table.
Thank you. So I have a question that's been submitted that asks, how can you help us to understand why masks are important? I know we talked about this a little bit, but I wanted to kind of revisit that question because I did have several questions about masks, why they're important, how do we understand this, and if a child gets the vaccine, will they still have to wear a mask? So I just wanted to just kind of revisit that for a second.
Well, I would like to say for those that are visual, just imagine sneezing and you can't see the droplets, but they can go like 6 feet. So you put a mask on and you're limiting how far those droplets can go. And I figured Delaney can follow up on that.
And it's a respiratory illness. This is the thing that I really want people to understand. It's a respiratory illness, as is flu. A lot of people think it's a stomach illness. It's a respiratory illness. There's a reason why a lot of us haven't had colds and flus because we've been covering our mouth and nose for the last 17 months. But it is a respiratory illness. These are the doorways to your respiratory system. Your mouth connects there in the back too. So it's like your side door. These are your direct entrance. So like if it's a bank vault, you don't want the robber standing there with the bank vault doors open. You don't want the picnic basket up there and the ants traveling up your nose for the picnic. If it's out there and you leave your entrance doors open, you have the potential to have COVID enter your body. And once in, it just starts to multiply. And none of us know how we're going to react. You might be fortunate. You might be the person who only has a little sneeze or nothing at all, but you might also be the person who's severely impacted. And unfortunately, some of those impacts are lifelong. I have seen it myself. I have seen relatives in my own family who have passed from COVID. I have seen people, coworkers who have struggled with COVID. I have seen people who have long-term effects, what they call the long haulers. It is a very complicated illness and it's a gamble. It's like rolling dice. You don't know what you're going to get. There's no way to know. It's like pulling the slot machine handle. You don't know. You don't know what's going to happen. So again, masks are the number one way we have to block our entrance for the COVID-19 to go up our noses and into our mouths. So cover your mouth and your nose, and you are going to be way ahead, light years ahead of people who don't. And if you're wearing a mask and letting it dangle on your chin, I don't know what purpose that serves. I really don't, unless you're trying to cover chin hairs or something. I'm not sure exactly what you're doing with that. It's not doing anything for you. So wear it in a functional way, teach your child to wear it that way. I will say, I have children ages 2 to 21 at Charlton. Those guys are rock stars. I mean, I am amazed at which of my students will wear masks. Children who have tactile sensitivity, who can't stand things touching them, tags in their shirts, will wear a mask like a trooper. We have some that are so into the mask wearing now they don't want to take it off. Like they don't want to take it off. Even when they can take it off or change it, they don't want to do it. They want to wear their mask. So it is doable. A lot of it is our attitude that we present to our children. So in school, it's an acceptable thing. Everybody's wearing them. Hey, they're part of the gang. They're just wearing their mask. I know it's a little more struggle with teenagers and with neurotypical children, but again, like model it for them, show them, wear it in respect for them, show them how to do it. It becomes like putting on a shirt or a pair of socks or your shoes. You put your mask on, you go to school, you don't think twice about it. It's our protection as nurses. It's how we protect ourselves. It's how we recommend you protect your child.
And this is Dana. Not only are you protecting yourself by wearing the mask, you are also protecting everybody else by keeping your respiratory droplets kind of contained in your space. And there's a researcher named, I think his name is Richard Corsi, C-O-R-S-I. I highly encourage you. He's an indoor air engineer and has done a lot of work and has a lot of data looking at the transmission reduction when both people are fully masked. So there is significant, now we have accumulated, as I said at the beginning, we have learned so much over the past year. We didn't know so much about how any of this works. And now we do have a pretty decent body of research and a lot of data showing that masking is incredibly effective at both protecting individuals from the droplets coming in and up your nose, as well as transmitting to other people. And people, even vaccinated individuals with the Delta variant, even if they have been vaccinated, we are seeing that they can be asymptomatic and transmitting the virus, again, even if they are vaccinated. So that's why in this situation, it is really important for everyone to mask, because again, even if you're vaccinated, you can both still get sick and as well as be asymptomatic spreaders.
Yeah, and the main purpose of the vaccine has been to prevent COVID disease, not necessarily COVID infection. Yes, that's a benefit of it. With Delta, they're seeing that there's an infection, but it is to prevent COVID disease. And right now, 97 to 99% of infected people are unvaccinated. So again, even though you can get it, you can transmit it. The likelihood of you personally getting severely ill or dying from COVID is much less if you're vaccinated. And what we're seeing now, what we're seeing sweep the nation, is actually a disease of the unvaccinated. So you can, look more into that as well. I did want to caution people though that children under the age of 2, because I do have students in my school under the age of 2 sometimes, and children who cannot physically remove a mask of their own doing should not wear a mask. And that's from the CDC. So you will see students occasionally who don't have masks and special needs, but that's based on their own particular issue. We do encourage it across the board beyond what the CDC contraindications are.
Thank you. All right, we are at time, so thank you for everyone that tuned in to the DOE YouTube channel to watch this live broadcast. And we did not get through all the questions, so I just want to acknowledge that we did receive more questions. It was a wonderful, overwhelming response of pre-submitted questions. So we will be addressing those, and we will reach out to you by email. So just to anticipate that and to reassure you that we did receive your question. And just to real quick remind everyone that the first dose of Pfizer vaccination clinics at our 4 sites: Seaford Middle School, William Penn High School, Howard High School of Technology, and Lake Forest Central Elementary School. Those vaccination clinics will, all 4 of them, be held August 19th. That's Thursday night from 4 to 8 p.m. And you can register, but walk-ins are welcome. And the vaccination is available to 12 and older. So I think that pretty much covers everything. I apologize, we went over a couple of minutes, and thank you to all of our panelists, and thank you for our support, our DPH supports, and Department of Education for hosting this live event. Take care, everyone.